Kanya kapag natulog silang gano'n, hindi lang yun it goes back. It blocks the respiration.
Kaya tinawag na obstructive.
Kanya tinatawag ng obstructive. Kanya itong dental appliance nito, I believe it has a role in the treatment of apnea. Primarily, nakita ko kanina, in pushing the tongue anteriorly.
Yes.
So, what do you call this appliance?
It's at first nilabel nila ng anti-snoring device.
Anti-snoring device. Yan po, anti-snoring device po yan, ano ha?
Wala pang pangalan siguro.
Wala pang pangalan yan, anti-snoring device. Ayan po, as far as snoring is concerned, that is dentistry and beyond. Bago po ito, kanya dentistry and beyond, yung pong episode natin, primarily, pakikita po ng mga dentista, yung mga bago nilang ginagawa. And this is one of the few cases in dentistry na masasabi natin na bago ngayon. At napakarami pong mga pasyente natin ngayon ng may apnea, yung mga iba naman, snoring lang. Naku, kawawa itong mga partners sila. Well, it's nice to hear from Roland. Now let us go back to our pretty and beautiful lady here from Angeles City, si Cynthia. Siguro po, next time po, kapag nakita ninyo ako, napakaganda na ako. Napakaganda po ng ngipin ko because of Cynthia. Meron po siyang dito meron po siya mga pictures dito that I would like to ask her about whitening of the teeth. Now, the first question, Cynthia, is kailan ka pa nandito yan? How come you fell in love with this kind of aesthetic surgery method in dentistry?
Aesthetic dentistry po or cosmetic dentistry po. Actually, nandiyan na po yan it's included in our everyday practice already. It just so happened na since dental medicine is ever evolving, so we have different trends, latest trends right now. Kaya marami pong innovations na papakita. Like one is bleaching or teeth whitening po.
Nung araw, yes, meron silang whitening na sinasabi ng mga dentista nun. But they were not as successful as today. Kasi even the movie stars now, makikita mo talaga, magaganda yung ngipin nila . And what is it? What is the technique that you are using now that make it so successful?
Marami pong techniques in whitening. So we have two different types. One is the in-office bleaching. Ito, very dramatic talaga. So, mga 1 hour lang, or say 1 hour or 2 hours in the office, basta i-prepare lang siya, then the bleaching procedure, gagawin siya within 1 hour. Very dramatic results na po. 6 to 8 shades lighter po.
Alam po ninyo itong bleaching na ito matagal ko na pong ginagamit yung bleaching sa mukha ako handsome pa rin po, pero hindi pa masyado paputi. Siguro, I'm going to ask Cynthia paano bang ginagamit niya sa ngipin bakit successful? Why is it successful now? Because of the ingredient that they were able to discover?
Yes, we use carbamide peroxide.
Ayun,
carbamide peroxide.
It's a whitening ingredient. It's a new whitening ingredient for the teeth.
Yes, for the teeth. This is used for take-home bleach. It's less. It has less sensitivity. It causes less sensitivity sa ipin po. Pero yung higher concentrations of hydrogen peroxide we use in office po.
Hydrogen peroxide. Matagal ko nang naraanan yan. Even sa skin condition, ginagamit ang hydrogen peroxide, di ba?
Pero in a higher concentration po.
Dito sa dental. Now, binigay mo kanina sa akin ito. Would you please explain some of these pictures? Kasi meron siyang smoking na. Ang ganda-ganda. Ang ganda-ganda po dito sa
These are unretouched photos of some of the patients, of some of the cases who are really good candidates for bleaching. Some here have very heavy nicotine stains. So, ang isa pong magandang candidate for bleaching po, yung heavy smokers.
Heavy smokers, ang daming ganyan eh.
Tsaka yung mga may deep stains, yun po. And yung mga yellow yung teeth. So ito po, smoker po to. Marami po siyang nicotine stains. So after bleaching, ito po, pumuti na ho yung teeth niya. Same with aging, pagka nagiging yellowish na yung ngipin. Lalo na pagka, syempre too much brushing, nagkakaroon ng abrasion, nagiging yellow na yung ngipin. So ang pag-i-bleach po, nire-restore po yung lightness ng ngipin. Ganun din po, pag genetic, yung color ng ngipin. Pagka yellowish po, or grayish, ito po. Pagka
Maganda naman yan, ano ha?
pumuputi po siya.
Now, lastly, yung sinabi mo sa akin kanina, yung puputi, how long will it last? It'll last po for a year. Basta the patient maintains good oral hygiene. Kailangan he visits his dentist regularly. And dapat he should avoid foods that stain. Any food na nakaka-stain ng white shirt, dapat i-avoid niya po yun. And important po, touch-ups in a year. Sige. Ngayon po, let us continue this for a few minutes more, because what I would like to ask you, Roland, is how much does it cost? Is it really, you don't have to put prices in here, but is it really expensive to do all of this? And how long will it take the patient to wear those?
Complete the treatment.
Yes, complete those treatments.
Okay. Usually, we gain success after about 3 months of wear. And
3 months. 3 months of wear.
And then we go into, if the patient is not healed during that time, we go beyond up to 6 months. I think it all boils down to muscle memory, physiology. Okay.
So it takes 3 months before those muscle memories will really come into play.
But see, we don't want to train the patient all the way to be protrusive. We don't want the patient to train all the way to have their tongue depressed. But this only done at night. Kaya hindi masyadong non-invasive.
So yun po, if ever, 3 to 6 months, yung memory po ng mga muscles will come into play. Now, ito naman si Cynthia. How expensive are these?
Nako, hindi naman po masyadong expensive. Actually, affordable naman po.
Affordable, ha?
Our prices range from yung pag-in-office po, 20 above.
Wow.
Pag shares, pagka take-home, 8,000. 8 to 10,000.
So, hindi naman affordable naman pala yun eh. Mga Kapampangan, mga Bulakeños. Huwag na kayo pumunta sa Maynila. Meron tayo dito sa Angeles, ha? Well, thank you very much for being a part of What's Up Doc, Dr. Roland and Cynthia.
Thank you.
Wag po maalis. Meron pa po tayong mga bisita that we're going to interview sa dentistry and beyond.